Okay, thank you so much, Mr. Chairman, for being so kind. Dr. Stone, I'm pleased that we have so many 20 vaccine candidates reaching the final stages. I come from the state of beautiful, beautiful state of West Virginia, very, very patriotic and an awful lot of veterans. And I imagine when the vaccines are approved, some of them will need specific storage temperatures again. And I would hope you all would take in consideration that in some of the smaller rural areas, we don't have the ability to handle that. So when you're designing what vaccine is going to go to what area, will you make sure that basically it's matched up with the capabilities of handling the vaccine so it doesn't spoil or is not wasted?
This is what kind of respect.
Is that part of your, sir, that's my question, I think.
It is, Senator, and as
Part of
you
your
know,
strategy.
because of the rural nature of much of your state, we've shipped over 37,000 doses to your state. It's all been Moderna, which has been easier to handle at a negative 20 degrees. None of it's been Pfizer. It's just too difficult to move
Absolutely.
that around. And it's given us the ability to actually immunize about 38% of the over 75-year-old veterans in your state.
We're going to need a lot more, as you know. All the states do. We understand that. But in the rural states such as ours, as long as you make sure that you're identifying the type of facility it's going to take in order to handle that new vaccines that they come, whether it be J&J or other ones I understand are coming on quite rapidly.
They are, and I'll defer to Dr. Kim as it's not clear to us what the guidance is going to be from the FDA and the CDC on the utilization of the new vaccine that will come. That's the single-dose vaccine. And so I'll defer to Dr. Kim.
Yeah, Senator, I'm sure you know from previous people who've testified here that the FDA is meeting this Friday to discuss the Johnson & Johnson vaccine and possibly authorize it if the data looks favorable this weekend. And we, you know, in the scientific community really like that vaccine because it is one dose refrigerated and can last apparently up to 6 months in a refrigerator, which makes it a great option for places that only have a refrigerator, such as maybe some rural facilities, maybe in your state. So it is a nice versatile option from a storage standpoint, as well as it's only one dose, which some veterans may really like.
Let me ask you this. In the weather conditions we've been having and some extreme weathers around the country, have we lost or is any of it spoiled, not being able to get to market or get to the end user?
We've had minimum wastage, and look, every dose is a tragedy. We had up in Vision 1 in the Northeast, a contractor who was cleaning up after a broken pipe with a flooded area, inadvertently unplugged one of our negative 70-degree freezers, and we lost a pallet of the Pfizer vaccine, so we lost about 1,000 doses. And so that's been the largest loss that we've had. Frankly, the VISN leadership have done the same sort of thing that Dr. Patterson did at 8 and 9 at night, where we're calling veterans and we've got cancellation lists. That's true across the nation.
A lot of the people live in rural areas. They don't have internet service. A lot of them aren't internet service. I know when you're contacting, trying to set your appointments up, what other than just a phone itself, how are you all able to communicate?
I'm going to defer to Dr. Patterson and Mr. Gelati about how they're doing their scheduling.
We do schedule as much as possible, but we also have some walk-in availability in a lot of places. But one of our big partners has been the veteran service organizations. So the Legion and the VFW, they have a lot of good connections in the community, and it's particularly in small communities where they're very strong. We set up events there, and they help us get the word out. We may use social media and robocalls and the local clinics, but that community connection really goes a long way.
I also was pleased to see the VA had been allowed to participate in Defense Production Act Committee and help determine the most effective ways to meet our nation's needs. However, even with the great new developments we're seeing with vaccines, we need to be prepared to continue to deal with the COVID-19 in the long term as we're seeing it. And if you're all prepared for that, so how has the VA's participation in the committee's decision on deploying the DPA helped you respond to the COVID-19 pandemic?
Sir, I think it's too early to say what our participation with the DPA has been. At this point, we are still working, and we've briefed our new secretary on our desire to be at the table in the Defense Production Act. But how the Defense Production Act is utilized, as well as our role and our voice as the largest provider of healthcare services in the nation, is one that I think still remains to be seen.
Are you able to get all the equipment you need? Is you getting the PPEs for your employees and everything? We're all,
Yes, sir.
and you have your portable, in West Virginia, we have a lot of the portable trailers that go around trying to help people who live pretty far away from a facility
sir.
or a clinic.
In comparison to where we were 6 months ago, our supplies of PPE as well as our emergency stocks and our rolling stock is in much better shape than it was early in the pandemic, even a year ago.
Are you able to spend shots out of your portables?
We can, and we are.
Yeah.
And we're using it mainly for transportation. We're finding for efficiency's sake, large open areas is a better place to go, and whether that's a parking lot with you.
They'll come. They will come, sir.
They will come, and so we're using that, but we are using the portable materials to transport and to assure the safety of the vaccine and the mixing of the vaccine when that's appropriate.
Thank you very much. And
Senator?
Mr. Chairman, I'm indebted to you being so kind.
You can stick